Well, switching gears, flu season hasn't officially begun yet, but if you're not sick, you may know someone else who is. Canada is bracing for a triple threat of viruses this winter. Cases of influenza, RSV, and COVID-19 are on the rise. CTV's Allison Bamford explains where in the country it's the worst.
This time of year, it's often not a question of if or when you'll get sick, but rather which virus you'll catch.
Flu and RSV are still forced to contend with, and we know our healthcare system is already stretched to begin with, so you add COVID on top of that, it just makes things more difficult.
The latest federal data shows RSV and influenza A cases increasing across the country, with more than 1,800 cases of the flu recorded between November 12th and 18th. Alberta and Saskatchewan seeing the worst of it while also dealing with steady COVID cases.
In the past 2 weeks, we already almost match, what we were seeing at the height of the cases at the height of flu season last year.
Flu test positivity across the prairies is nearly 17%, 10% higher than the national average. Of Canada's 11 flu-related deaths recorded since the end of August, 5 happened in Saskatchewan in the first 2 weeks of November.
Our vaccine uptake is not very high. It needs to be higher, particularly for flu, but also for COVID.
Down east, doctors say the flu hasn't taken over quite yet. Right now, Ontario, Quebec, and Atlantic Canada are seeing higher COVID positivity rates than those in the West, with Ontario's COVID wastewater level at its highest in more than a year.
The hospitals are packed with people with COVID. They're really struggling in terms of beds.
COVID isn't expected to pack a punch like it did in the peak years of the pandemic, but medical experts say that's no reason to let your guard down. Masking, hand washing, staying home when sick, and most importantly, vaccinations will go a long way in fighting off viruses and alleviating pressure on the healthcare system. Allison Bamford, CTV News, Regina.